Trauma-Informed Care in Nursing Homes video series. Video 6, Trauma-Informed Care for Teens. Welcome to our Trauma-Informed Care video series for nursing home staff. Today we'll be talking about the ways that trauma-informed care can be used to support staff. Nursing home jobs are hard. The idea behind trauma-informed care is that trauma-informed approaches reduce re-traumatization for everyone involved in an organization: staff, residents, family members, and so on. However, we need to acknowledge that providing trauma-informed care could involve experiencing someone else's pain from a past trauma experience. Providing trauma-informed care can also bring up past trauma experiences that staff have. This video is directed at you, a nursing home staff member, to share the ways that you can work on changing your nursing home's culture to be more supportive and things that you can do to support yourself in doing a difficult job. Ideally, trauma-informed care is provided within trauma-informed systems, where everyone who works there is aware of the impacts of trauma on human behavior and the ways that people experience care. Nursing home leaders should lay the foundation by promoting a culture that supports staff through transparency and empowerment. However, even in a less than ideal environment, staff can make the culture more trauma-informed. For example, one principle of trauma-informed care is peer support. Are there ways that your peer group, people who have the same or similar jobs, can be explicitly supportive to each other? Can you develop informal support groups through huddles? Can you create a system where a staff member can ask to be tagged out if a situation becomes overwhelming? In a long-term care setting, we work in teams, which offers a unique opportunity to provide daily support, particularly during caregiving, which can contribute to stressful moments throughout the day. This mutual aid can enhance resilience in the workplace, especially during difficult times. It's important to be deliberate about maintaining this team environment because it can be the first thing to go when things get difficult, but it's then when it's needed the most. This type of workplace culture can create a safe environment where people feel confident expressing their caregiving reactions. Think back to a moment when you felt you had no one to turn to, formally or informally, when you needed to talk through thoughts or emotions. If no one was there, how alone you must have felt. Vocalize concerns and step in, help or replace a coworker having an especially difficult time with a resident. As a trauma-informed person, you can recognize that all staff can potentially be re-traumatized by resident behaviors due to their own past traumatic experiences. It can be particularly hard when staffing is short and staff is asked to care for more residents than they should in any one shift. I want to acknowledge that we know that in some places this does and has gone on for months. That's when it's most important for staff to support each other in tangible and intangible ways, and for leaders to find creative ways to increase staffing and support the staff you have. Trauma-informed care is a combination of organizational culture and personal actions. Now we'll talk about two simple practices that every worker can do on their own to reframe their own experience and reduce the stresses caused by the workplace. First practice is called doorway waterfalls. Walking through a doorway into a resident's room is an opportunity to imagine a waterfall coming down from the doorframe, washing off the stress of all the previous interactions of the day, allowing a more present and calm demeanor as you enter the room. Upon leaving the room, the same doorway waterfall can wash off any stress from that resident interaction, so the next interaction with the patient can feel clearer and less encumbered. This practice avoids compilation of stress throughout the day. Another important practice to providing trauma-informed care is the ability to step away from the workplace and participate in the activities that bring you personal fulfillment. One way to ensure a break between work and home is to end each day with this brief badge ritual. At the end of the day, when you take off your badge, always put it in the same place. As you do that, picture yourself taking off the stress of the workday so that you can be fully present with your loved ones and restore yourself during your time off from work. That includes putting down with the badge any thoughts about the people, paperwork, or politics from the workplace, and not checking work messages, but being really, really off and away from the worries of work. The next shift, when you go to put the badge back on, recommit to being present with residents and providing trauma-informed care. Potentially traumatic experiences are part of life, and chances are high that not only the residents, but also the staff in your workplace have experienced one or more in their lifetime. Perhaps you have as well. We have learned there are things we can do as organizations and as individuals to help reduce the effects of the stress and triggers we may experience from working and even living with trauma. I hope the practices described in this video can empower you to help make your workplace more trauma-informed by the ways you care for your residents, teammates, and yourselves.